Today, we're talking about Qinlock 50 mg tablet, which is used to treat a specific type of stomach, bowel, or esophagus cancer called gastrointestinal stromal tumor, or GIST. Qinlock belongs to a group of drugs called kinase inhibitors, and it helps to slow down or stop the growth of cancer cells in the body. It's important to take this medication as prescribed by your doctor, and they will determine the correct dosage for you. It's typically taken once a day, with or without food. Be sure to follow your doctor's instructions carefully, and if you have any questions or concerns, don't hesitate to reach out to them. Before you start taking Qinlock 50 mg tablet, make sure to read the patient information leaflet from your pharmacist. Take this medication by mouth with or without food as directed by your doctor, usually once daily. Swallow the tablets whole. If you vomit after taking a dose, do not take another dose. Take your next dose at the regular time. The dosage is based on your medical condition, response to treatment, and other medications you may be taking. Be sure to tell your doctor and pharmacist about all the products you use. Take this medication regularly to get the most benefit from it. To help you remember, take it at the same time each day. Do not increase your dose or use this drug more often or for longer than prescribed. Your condition will not improve any faster, and your risk of serious side effects will increase. Women who are pregnant or who may become pregnant should not handle this medication or breathe the dust from the tablets, as it may harm an unborn baby. Some common side effects of Qinlock 50 mg tablet may include tiredness, muscle ache/pain, constipation or diarrhea, itchy/dry skin, headache, loss of appetite, stomach/abdominal pain, nausea, or vomiting. Temporary hair loss may also occur, but normal hair growth should return after treatment has ended. However, people using this medication may also experience serious side effects. Your doctor has prescribed this drug because they believe the benefit to you is greater than the risk of side effects. Careful monitoring by your doctor may decrease your risk. Serious side effects may include easy bruising/bleeding, slow wound healing, symptoms of heart failure, and a skin reaction called hand-foot skin reaction. It's important to limit your time in the sun, avoid tanning booths and sun lamps, and use sunscreen and wear protective clothing when outdoors. Depending on how severe your hand-foot reaction is, your doctor may give you an additional medication to reduce the symptoms, or stop or delay your medication treatment. This medication may rarely cause new skin cancers, raise your blood pressure, and lower your ability to fight infections. It's important to check your blood pressure regularly and tell your doctor if the results are high. Tell your doctor right away if you have any signs of infection, and seek medical help right away if you have symptoms of a heart attack or a serious allergic reaction. If you notice any other effects not listed above, contact your doctor or pharmacist. Before starting ripretinib, it's important to let your doctor know if you have any allergies or if you have a history of high blood pressure or heart disease. This medication may increase your risk of getting infections or making current infections worse, so it's important to avoid contact with anyone who has a contagious illness. It's also important to talk to your doctor before getting any vaccinations while taking this medication. To lower your risk of injury, be cautious with sharp objects and avoid contact sports. If you have surgery planned, make sure to inform your doctor about all the medications you are taking, as you may need to stop taking ripretinib before and after the procedure. Ripretinib can make you more sensitive to the sun, so it's important to limit your time outdoors and use sunscreen and protective clothing. If you are pregnant or planning to become pregnant, it's important to discuss the risks and benefits of using ripretinib with your doctor. Additionally, women who are pregnant or may become pregnant should avoid handling ripretinib tablets or breathing in the dust from the tablets. If you are breastfeeding, it's important to consult your doctor before using ripretinib, as it is not recommended to breastfeed while taking this medication. It's important to be aware that other medications can impact how Qinlock works in your body. This can affect how effective Qinlock is in treating your condition. Make sure to keep a list of all the medications and herbal products you are taking and share it with your doctor and pharmacist. Do not make any changes to your medication without consulting your doctor first. Some medications, like rifamycins, St. John's wort, and drugs used to treat seizures, can affect how Qinlock is removed from your body, which can impact its effectiveness. Be sure to discuss any other medications you are taking with your doctor to ensure they won't interfere with Qinlock's benefits. If someone has taken too much Qinlock and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help by calling 911 or a poison control center. In the U.S., residents can contact their local poison control center at 1-800-222-1222, and in Canada, residents can reach out to a provincial poison control center. It is important not to share this medication with others. Before starting and during the course of taking Qinlock 50 mg tablet, it is necessary to undergo lab and/or medical tests such as complete blood count, skin exam, and heart function. It is important to keep all medical and lab appointments. If you forget to take a dose of Qinlock 50 mg tablet, you can take it as soon as you remember if it's within 8 hours after the missed dose. If it's been more than 8 hours since the missed dose, then it's best to skip the missed dose and take your next dose at the regular time. It's important not to take a double dose to make up for the missed one. It's important to store Qinlock 50 mg tablet Antineoplastic, Protein-Tyrosine Kinase inhibitors in the original container at room temperature, away from light and moisture. Make sure to keep the desiccant, drying agent, in the container to protect it from moisture, and do not store it in the bathroom. Keep all medications away from children and pets. When it comes to disposing of the medication, do not flush it down the toilet or pour it into a drain unless instructed to do so. Properly discard this product and it is expired or no longer needed, and consult your pharmacist or local waste disposal company for the best way to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.